A very good morning. I request some of the students to unmute themselves.
Good morning, ma'am.
Unmute, and you can have in between, we will have interaction. How many are there? So I'm seeing 59 students are there. Okay.
Good morning, ma'am.
Good morning. So today's class is just a discussion. I'm going to have one-to-one interaction. Let us have with each other. So already you have been taught about the communication basics or the communication skill. So under the medical education, or you can say NMC AETCOM module, the foundations of communications you have seen in the previous class. It was told about what are the ways of effective communication, how you are supposed to communicate in the healthcare sector. So the aim of NMC that they are going to have this module is to create or to make the Indian medical graduates a competent doctors to have the global achievements, or you have to be a successful Indian medical graduate in the global scenario. That is the basis of giving all these different teaching learning modules as per the NMC. So you have been told about AETCOM model, then the other modules under this thing, that is early clinical exposure. Next is the discussions, didactic lectures, small group discussions. All these activities have been implemented to make you a well-groomed, well-behaved, and a successful healthcare worker in the tomorrow setup, or healthcare provider, I can say. Ultimate aim of this is to have a competent healthcare provider as a doctor that you are going to be in the tomorrow society. So, keeping that in mind, you have been taught on various aspects of this. So this AETCOM stands for Attitude, Ethics and Communication Model. So basically this AETCOM model is to train you how a doctor should be when he is communicating with the patients. So this AETCOM model of teaching learning is going to teach you about your role as a doctor in tomorrow's society. So that is why it is necessary to know what a doctor should be doing when he is communicating with his patient, because this interpersonal relationship is going to decide how successful you are going to be in tomorrow's scenario as a doctor in the society. So, before I start, I just would like to listen from you. What are your expectations when you go for consultation to a doctor? So, what do you expect from them? Just you can give me your responses. Tell me what is your expectation when you go for some illness for the consultation with the doctor. Yes, Shreya, can you unmute and answer? This is our day-to-day life. We are coming across this. So when I go for a consultation to a clinician, what are my expectations? How the doctor, and when I will be comfortable with the doctor. So what are your expectations as a patient from the doctor? Yes, I want the communication from you. Shreya, unmute and tell me. Anybody? What do you expect when you go for consultation? You don't have any expectations? Anybody is there or not? I am seeing number of students here. Yes, Harshita, Joseph, any one of you can unmute and respond to my question. What are your expectations when you go to the doctor for consultation? Anyone, you can tell me. This is what is the basis of communication. Are you able to hear or me or not?
Yes, ma'am.
So what, just respond what I am asking you. What basically we expect from a doctor as we visit as a patient? What do you, anytime have you been for consultation, Ishika?
Yes, ma'am.
So what was your experience there? What was your expectation? Did it meet what you were expecting from the doctor?
Uh, the doctor being on time.
Okay, unmute. Ishika, you can
Uh,
unmute.
the doctor coming in on time for the
Right,
appointment.
right. So was he in time or on time?
Sometimes yes, sometimes no.
Okay, okay, next. Any other thing? Is there any network problem, Ishika?
Yes, ma'am, a bit.
Which place you are from?
Mumbai, ma'am.
Mumbai. So see, this is our communication problem because of this technology. This is another problem in the setup of the communication. So interpersonal communication and technological communication, these are the two different aspects. So I am talking about the interpersonal communication. So at least you have told that, yes, I expect that the doctor should be on time. That is there, right? Next, once the doctor is on time, you have been, okay. So I think nobody is interested in answering, right? But it will be better if you also get involved in the today's discussion. That is what I want, that all of you should be getting involved, which is nothing, but it is not going to be taxing for you. This is not your biochemistry as such the topic. This is in general what we expect in the workplace, where we have the interpersonal communications among us. So I hope all of you are having a nice morning. Already you have started your day with the classes, and now today next class that I am going to deal is about the AETCOM module 1.4, that is the foundation of communication. So all of you know myself, Dr. Nilima Dongre from the Department of Biochemistry, BLE University. I am going to deal today with the aspects of communication with the patients. So today's my talk will be about communicating with the patients, that is the AETCOM module 1.4. as per your syllabus, under which importance and techniques of effective communications I am going to deal. Already in the previous class of Foundation of Communication, you have been in detail told about the basics of communication. What are the communications, how it should go, what are various barriers of the communication, how you have to improve these barriers for effective communication between patient and a doctor. So that basic understanding, I think all of you have now. So with that, now I'm going to move towards the next aspect of this module, that is the small group discussion. Actually, it is self-directed learning. That is, we have to get it from from you, basically after guiding you about the basic information of these communication modules. There are two models of communication that I am going to deal with today. So once I tell you about those models, next is what is expected of you is you have to write the reflections and about what you have understood about the various techniques of effective communication and their importance, that you have to write down. This is what is expected from you. And this is a component of self-directed learning under this module of Foundation of Communication. So my objectives for today's discussions are, so the specific learning objectives are, we have to understand two models of communication that can facilitate a doctor and patient relationship. Then the another, under this, what are these two models? One is the 5 ways behavior change model and the second is Kalamazoo consensus statement. So I have collected this information from the reference, that is the AETCOM module book, which manual book, which has been recently published by an author that known as Nitin Akash John. Publisher is CBS publisher. So this I could get, and from that I have collected the information. Apart from that, this Kalamazoo statement from the reference published in the 2001. Also, I have taken some of the slides from the Google Images for effective communication slides and all that I have collected. So we will be trying to understand today the basics of the importance and the techniques of effective communication in the today's lecture. So before I start, just to revise, recall what you have learned in the previous class, that is, what is communication. So this is what is exactly the idea about behind communication is, I want to transmit an idea or feeling with someone else. So it is the definition of this communication can go technically as it is the transmission of an idea or feeling so that the sender and the receiver share the same understanding. So what I want to convey to the receiver, now today you are the receivers. So what I want to tell you, I should be able to convey it in the proper way so that you can get what I am intended to tell. So this is what is the communication. So communication is the transmission of an idea or feeling so that the sender and the receiver share the same understanding. So there are two components here. One is the sender, the second is the receiver. And the media or the way by which we are going to communicate each other, these are the communication skills. So to be effective, this communication should have certain guidelines. So what are those? Now in day-to-day life, we come across communicating with many people in our surroundings. In take your daily life, You have to think since early morning when you get up till you go to bed. You come across how many people are there. They can be your relatives, they can be your neighbors, they can be friends. So many people, and you vendor, it can be a laundry boy, or so many people we come in contact in our day-to-day life. But they, how many of them do remember you, or how many of them, and out of them, do you remember them? What is the basis to know each other, to understand each other, and to convey what we want to get from them? So all these things that we are going to do with this communication, that is how we can remember each other, that is how we can convey the things to amongst each other. So it can be a group of people, it can be an individual with whom you are communicating. So it is necessary that you communicate it in a proper way. So this is not a mysterious process. It takes place when the ideas from your mind are transferred to another's and arrive intact, complete, and coherent message. So it is the transmission of idea or feeling so that the sender and receiver share the same understanding. So this communication is the transmission. It is a process of exchanging ideas, information, thoughts, feelings, emotion. And how it can be achieved? It can be achieved through the speech, through the signal, through the writing. So there are various ways by which you communicate with each other. So in this technological era, most of the communications in the software sector, you can say Silicon Valley, nowadays what it is going on, it can be achieved through the write-ups. So that write-up also should be properly done. When it is in a public, it can be achieved through the speech. Also, at some places, we have to use signals to communicate to each other. So, but in the doctor-patient interaction, it is one-to-one interaction, and the patient is going to talk to you. You are going to convince the patient or convey your diagnosis, your plan of action, your treatment strategy to the patient. So this should be effectively done. So this is what is based on the information, ideas, thoughts, feelings, and emotion. All these things are going to be there in this. So effective communication is the process of sending a message in such a way that the message received is as close in the meaning as possible to the message intended. So you should be able to understand each other. And that is why you have understood last in the previous class how you can improve these communication skills. So to be effective, what are the various tips that you should follow during the communication? So the first tip is the body language that you should have. While communicating with a person, you should keep appropriate distance. Sometimes you have to touch the person when you are conveying some emotional messages. So touch only when it is appropriate. Next important aspect is you have to take care of your appearance, so your body language, how you have been groomed, how you are dressed up. All these things are going to matter, and that is going to help your body language, improving your body language. Next is you have to be aware, because you have to be knowing the facts, what is going to be there. Sometimes just by listening to somebody else's opinions, you cannot make your mind about the situation or about the person. Never do that in your life. It is your own perception you have to do about the people. So do not have that prejudiced mind before you meet or greet anyone, before or about any situation, about anything that you are going to be in. You can say you are going to get during your meetings or your interactions. So you should not have your own thoughts by listening to others, should not make any of the cues about that particular situation, organization, or the people who are there, or any person who is going to be there. So always you have to be aware of the things, but do not bend on the false cues. Always during communication, you have to be confident, and with that confidence and positive attitude, you can maintain the eye contact with the person with whom you are communicating. And during the conversation or communication, wherever required, you have to smile genuinely. It should not be the laugh, or you can say aggressive laugh that will hurt the feelings of the person who is listening to you or who is in conversation with you. So these are the basics of the communication. So we should have the physical barriers. Unnecessary, you should not be worried. Emotionally, you have to be careful. Emotional barriers, cultural barriers, negativity, and language barrier, gender barriers, all these things are going to be affecting your communication. Next, when you are communicating or conversing with a person, you have to be looking about the surroundings also. So it should not be noisy when you are communicating with the person. Your tone, language, through which you are trying to communicate should be adequate. It should not be too louder, too small, too lower tone, and the attitude by which you are communicating should be always positive attitude. And when the positive attitude is attained, when you have sufficient or competent knowledge about what you are talking or trying to convey to the person. So leave your worries, emotions, you have to control. Whenever you are communicating with the other person, you have to control all these things and then try to talk to the person whom you are intended to. Then it will be effective communication. So you always have to, the tools for the effective communication, you have to be brief, you have to think what you are going to talk to him, then the mannerism, basic mannerism you should follow, then using I or we. When we are in the group or team, it should be the we. Don't always use I. Whenever we are in a team, you have to use you. As a team leader, it is your collective effort that is going to impact on the team. So use of I, you have to be very careful. Then have positive approach. Apart from that, you should have the ability to listen what the other person is trying to convey. So have the good listening ability also. Let the person who is speaking finish his word and then you add up. So then you have to use the appreciating words also. Many a times you have to convey Yes, you have done well. It is right. Like that, you have to spice up your words. You have to have the clarity in what you are communicating, and your pronunciations also should be proper. So these are the tools for effective communication that you have already learned. So the effective communication cycle will go through these things. Message and is sent to the from the communicator to the receiver, and then the receiver interprets it, and from that what you get back, that is the feedback or the same thing. I would like to give our example in our setup only. What we are teaching you, if you perform well in the examination, then definitely it is going to be a good feedback for the teaching of any teacher or the department as a whole or the institution. So outcome basis or the outcome will decide how good communication has been done from the student point of view. So the all these things go through the barriers of effective communication. What are these barriers? When the communication go wrong, it can be because of lying, deliberately decepting of the others of the gain. Then your perception about the situation, about the person, about the organization, all these things are going to be the impact on or going to affect the communication. Next is over eagerness to respond. Instead of listening to the other person completely, in between only when we try to interact, that is the over eagerness to respond, and that is going to hamper your communication. So that is another barrier for effective communication. Next is judgments, snap judgments. Listening half and immediately giving your opinion about that is going to lead to it is another barrier for the effective communication. Closed words. Some hindrance you will be keeping. Instead of communicating in detail, you have to you are doing it selectively. That time again it is going to affect your communication. And then interpersonal attacking. During your conversation, if you are trying talking about somebody else or the third person who is not there, that is also not a good way of communicating. And then judging the people, poor listening, and again I have told the environmental factor, that loud, noisy environment, that is also going to have the impact on your communication. So the principles of effective communications that you have to think is break down information into essentials. So what you want to convey, only that much you have to talk. Keep the amount of information given at any time small. Don't overload. Whatever I know, I should not be bombarding on the other person. You have to be specific what you want to convey to that person. Then keep the chain of information transmission short. You have to be as brief as possible. More information will be lost or distracted. Maybe the other person who is listening to you is not interested to get it. So you have to take care of all these things. Make sure the message is received and understood. That can be attained by feedback. And showing is often more effective than telling. So for that, both the communication can be more effective in creating a scenario for the person to understand better. So for this teaching, learning, or this foundation of communication, the third aspect of small group activity is the role play, by which we will be trying to convey you how effectively or how the doctor should communicate with the patient. So through role models or group activity or role plays, we can effectively show you or teach you about the effective communication. So next aspect of foundation of communication, we are going to do that. I hope it will be possible for us, because we need you in the campus. When you are here only, that time we can make some arrangements for role play, or we will try to show you some videos related to that. So how the doctor should communicate with the patient, what he is not supposed to do during the communication. All these things will be done in the later small group activity. But now today I am just going to brief you about the what is the basic for that role play that we will be understanding today. So wherever possible, use two-way communication. It takes longer, but it is more effective. So there should not be a monolectic. It should be a didactic communication. Record important data. So during communication, important points we should note down. Don't expect everyone to interpret the same data in the same way. So people will have different perceptions, perspectives, and based on that, they may have their own point of view that we have to understand and respect each other. That is also important. Information has to be shared in order to be used. So whatever is the best, we have to come to a conclusion by gaining the aspects, or you can say perception and perspectives from all, and then we can come to a proper conclusion. Next is effective oral communication requires careful listening. God gave us 2 ears, but only one mouth. So why is it that so many of us talk twice as much as we listen? Actually, we should be a good listener during a communication. Listening half and responding to that is going to create havoc in the relationships. So also, so always have a habit of listening carefully to the other person, and because of that, don't you will create yourself the facts, assumptions, and that should not happen. So don't confuse assumptions with the facts. Remember that we are constantly communicating our feelings, attitudes, non-verbally also. So we have to take care. It is not only the verbal communication is going to affect the interpersonal relationship. It is going to be also monitored by the non-verbal ways of communication. So if our spoken message is at variance with our non-verbal message, the result is confusion and poor communication. So it is also going to reflect that. So you have seen the components of non-verbal communications. So non-verbal communication, we deliver our meaning by the voice, the words we use, and the body language that we use. So around 55% of our communication is effectively given by the non-verbal communication by the way of body language, and it is up to 55%. So your facial expression, body stance, and your gesture itself is going to decide how effectively you are going to communicate to the other person. Then it is decided by the words that you use or select to express your message. It is about 7% non-verbal communication. And voice, the tone, volume, pitch, pace, and the modulation of your voice is going to be effectively done, and that affects about 38% of the communication. So the non-verbal skills of this communication are determined by your body language, words, and the voice, tone of the voice. And so most of the messages are 93% of the whole communication is based on the non-verbal communication. So it is going to be decided by the content. Actual text we use is only 7% in our daily life. Paralinguistic, that is voice, the way in which something is said, accent, tone, inflection, errors, structure, mannerism, pronouns, speed, articulate. So all these things around 38%. And the body language consists of the posture, gesture, eye contact, orientation, proximity, looks, appearance, and grooming of a person with expression of emotions is going to be 55% of the body language will be affecting via the non-verbal way of communication. So human communication consists of 93% body language and paralinguistic cues, while only 7% of communication consists of words themselves. So it is the first impression that is going to be created by the person who is going to last till the communication is over. So all these points we have to keep in mind to have the effective communications. So non-verbal, what should be your posture, how you have to be maintaining the distance. So is the posture upright or slouched? Are you too near or too far? Are you higher or lower than the other person? That is going to determine the non-verbal communication. Eyes, is it a gaze, relaxed look towards the receiver, or is it friendly look with through your eye contact? So do you maintain eye contact or avert it? So you have to be like a lighthouse that is maintaining continuous eye contact with the receiver. And then mouth, do you hold your jaw tightly? Is the smile appropriate or misleading? All these things are being noted during the communication. Your voice, tone, inflection, volume, that is also going to be there. Is the voice coming as a whine or bellow? Or does the tone reflect sarcasm? That will determine how you are going to communicate with the person. And the gesture, watch for hands over mouth or clutched behind the back, shifting from one foot to another or arms folded. Are you following all these things during communication that you should be aware of these things? So non-verbal communication, body language has got all the points: posture, appearance, head movements, hand movements, eye movements, facial expression, body context. Next is closeness and sounds, ways of talking with pauses, stress on the word. So all this is going to help you in effective communication. So it can be a one-way communication, two-way communication, or one-to-many. So all these things are we are coming across. So these all basic things you have learned in the previous class. Is it not so? I just had to recall it to get the link from your previous class to today's class about communication in the healthcare setup. So how I can communicate effectively with this healthcare patient. So main focus today's discussion will be on the communication between the patient and the doctor. So this communication is a fundamental prerequisite in the medical profession, and bedside clinical skills is crucial in ensuring professional success for the doctor. So for you to be a successful doctor in the society tomorrow, you should have the proper knowledge about how the doctor-patient communication should be effective. So the purpose of this module is to provide the student with an introduction to doctor-patient communication, how the doctor-patient communication should go to have the success in your profession. So here now we are going to understand about the 5 A's elements of behavior change model that is used for effective doctor-patient communication. And the second is the Kalamazoo consensus statement, which provides a working model for teaching communication skills and that can be used to impart communication skills. So these are the two models they have proposed. This is the work of many professional healthcare providers, their meetings, their feedbacks from their patients they have obtained from different countries. They have stacked together and they have come across to achieve the goal of successful healthcare provider on the global scenario, this has been provided in the form of these two models of effective doctor-patient communication. Got it? So first we will start with the communicating with the patient. The first model, that is 5A's behavior change model. You should be knowing what are these two models, what are the points that are being given and expected of a doctor while communicating with the patient. So first model is the model that is called as 5A's behavior change model. So this model of patient communication is based on providing a patient action plan. So at each level of these 5 levels of communication, we have to understand what are these 5 A's. First is assessing the patient. Second, advising the patient. Third, agreeing with the patient. Next, assisting the patient. And fifth is arranging for the patient. So this is 1, 2, 3, 4, 5. So these are the 5 A's: assessing, advising, agreeing, assisting, and arranging for the patient. So this is about the 5 A's model. Further, we are going to in detail about each of the points here. So patient action plan based on these 5 levels is provided for each level of communication. So listing specific goal in behavioral terms, listing barriers and working out strategies to address the barriers, specifying a follow-up plan, sharing the plan and with the practice team and the patient social support. So based on these things, first you have to go through this, and based on that, as a doctor, you have to make a patient action plan based on these things. So once you communicate with the patient, you will come across knowing what is the patient situation, what is you have to do as a treatment for the patient, whether the patient is agreeing with you or not. Then you have to take care or provide some support for the patient situation. And then if he or she needs some extra help, you have to be in a position to create or assist him to come out of that situation. So first is, and that will decide your action plan. As a surgeon, if a person comes to you with some situation or some health condition, then you have to assess him, you have to come to know about his situation, you have to understand, you have to convey, you have to give him what are the probable strategies which can be used to come out of that situation. If the patient agrees, fine. If not, what are the other possible ways that we have to look into? And then you have to convey with the patient or the person who is attending with him or his relatives. We have to make the patient comfortable, and that is going to decide the exact action plan for that particular patient under the situation in which he is communicating with you. So these are the listing specific goal in behavioral terms, listing barriers, specifying the follow-up plan, sharing the plan with the practice team and the patient social support. All these things we have to keep in mind. So first point, that is assessing a patient. Now, when the patient comes to you have to take in account the beliefs, behavior, and the knowledge of the patient during his or her consultation in the healthcare setup. All of us know the patient will look at the doctor as a God. He is no more than God for the patient in that particular situation. So he looks him with all the faith he has to get relieved from the problem he is having. So it is next to, or you can say he is like God only. This is what is our general belief about the doctor is in our today's scenario. So we have to take into account all those things. When the patient comes, the doctor should take into account all these things once the first consultation, the patient comes to the doctor. Next is having the patient periodically complete valid health and behavior surveys during the feedback. It can be facilitated. So to know the local beliefs, behavior, we should have this is background work to be done by the doctor. He should be aware of the local culture, beliefs, and all the knowledge situation, literacy of the person in that area where he is working. So that he can do through the surveys and the feedbacks received. So this background knowledge he should have when he is working in that particular area. And these surveys must essentially bring out the barriers to the provision of healthcare from the patient's point of view, so that the healthcare team can address them appropriately. So assessing the patient will be based on all the points that the doctor has about the local barriers, beliefs, knowledge in the setup where he is working. So first point, assessing a patient. So when a patient comes to you, with your background knowledge, you have to listen to the patient, what he or she is telling. Second, advising the patient. So it is must for a doctor that he must provide the patient with specific information about the risks for his or her health. Now, after examining and going through his previous history or any investigations the patient has undergone, or an examination done by the doctor himself, he will come to a conclusion about the patient's condition or what he or she may be suffering from. So he will know about that. Now it is the duty of the doctor to give in detail information about the patient's present situation and about the treatment modalities also. So if the treatment is being provided, how it is going to be effective, what are the risks involved in the treatment that he or she may undergo, for example, certain surgery or the scanning of the patient, depending on patient's condition, if it is required, then what are the risks related to patient's health, in addition to the existing problems, if are there, that the patient should be made clear in the beginning only, before it is to be applied. Next is an analysis of the patient's behavioral response to the plan of the proposed health management is done, and a change in the patient's behavior is suggested for the successful outcome of the information in the patient's health. So once you communicate this to the patient, he or she will receive it, respond to that, will tell whether he is able to undergo that particular surgery or investigation, or he is able to do it or not, or there is any problem because of some circumstances, financial, emotional, or any other problem in the family. All these things you have to take into account, and that is going to help you in the further plan of action. So you have to advise the patient correctly by giving all the information related to his or her health and the risks associated with the treatment strategy. Next is agreeing with the patient. So it is carried out by collaboratively setting goals based on patient's interest and confidence in their ability to change the behavior. And that will be based on cooperation of the patient's family, will be also helpful in facilitating this process. So if you have to see whether the patient is in a position to afford that, or is he ready to undergo that treatment or not. So you have to agree with the patient depending on the situation. That will create the confidence in the ability to change the behavior. And next is the assisting the patient. So it is carried out by identifying personal barriers in the proposed plan of action, formulating the strategies that overcome these barriers and allow the desired outcome of patient care to be achieved follows this. Next is the social and environmental support largely facilitates this level of communication. Now, here, how you can assist the patient? Suppose if that diagnostic or therapeutic strategy is not available with you, you can assist the patient by telling or giving him the right information about where from he can get the things done, or if it is not possible for the patient in that area, depending on the location or area, if it is not possible to undergo or to do that in your clinic, you have to help him or by guiding him where he can get the better facilities than what is available, so that it can be easy for the family as well as the patient to get rid of that clinical condition. So this is, you have to, once you listen to the patient and the family members completely, then you can come to the fourth level, that is assisting the patient. So you can identify their personal problems and then you can suggest the plan of action accordingly. This is the fourth, assisting the patient. And next is the arranging for the patient. Now this will be if you are not, or the patient is not in a position to do it in the appropriate time, what you are suppose for a surgery you have given time for the patient that it should be done within these 2 weeks, or if it is urgent immediately you have to take the patient for surgery, and so that, or it can be delayed for some time, and during that period if the patient is going to be out of station, then you can think of the other doctor or some other specialist in that area where the patient is supposed to go there during his work plan, or we can say he may have arranged for the family tour or some commitment of the his business or job. In that situation, you have to see that is it possible for you to arrange some other person nearby locality where the patient is going tomorrow. During that period he will be visiting those places, so nearby your friends or your specialities can be arranged for him. So this refers to the plan of the patient following his or her stay in the hospital, one thing. The second is scheduling subsequent doctor patient interactions, and this can be done using email, phone call reminders that can facilitate the easy follow-up for the patient, as well as the patient can be treated at some other parts of the area. So the patient and their families must be appropriately educated at this level of the communication. So the follow-up can be done through this. Nowadays, though, it has become very easy. You can have the communication through email, phone call, and that facilitates the process of patient recovery also. So this is arranging for the patient that we have to have. So all these 5 A's, that is assessing, advising, agreeing, assisting, arranging. So all these 5 A's will definitely change the perception of the patient towards the doctor. So this is called as the 5 A's behavior change model of the doctor-patient communication. And it is mandatory that this model should be implemented in the healthcare setup following training of its healthcare providers in patient-centered counseling and empowerment. So ultimate goal will be to make you. So now as I am teaching you, this is you are the healthcare providers tomorrow. So you should be knowing all these points. That is what is the your training for the tomorrow's healthcare setup, which should be mainly for patient-centered setup. This is what is the 5 A's behavior change model of the doctor-patient communication. So with this we have come or finished or we have come to the end of the first model of communication, that is doctor-patient communication, that is 5 A's elements of behavior change models. Now let us understand about the second model, that is Kalamazoo consensus statement assessment tool. So this Kalamazoo's consensus statement 1 identifies 7 evidence-based essential elements or the tasks of effective doctor-patient communication or physician-patient communication, and that provides skill competencies for each element. So this was being put forth by 21 medical education leaders and communication experts from the US and Canada who developed the Kalamazoo consensus statements in 1991. It should be 19, a typographic mistake is there. It should be 1991. Please correct that. And then made in subsequent years to create the Kalamazoo Essential Elements Communication Checklist and other resources. So this concession tool was put forth by this team from US and Canada. So this group outlined the key communication skills for building therapeutic relationship with the patients and families. So their ultimate goal was to delineate a set of essential elements in the physician-patient communication in order to identify and articulate ways to facilitate teaching and assessment of communication skills at all levels of medical education. So this was mainly for the teaching and assessment of communication skills at all levels of medical education. So you will be assessed. This is your first level of medical education. Next, when you go towards the next second year of graduation, this is your second level of communication. Again, you will be assessed at the third level when you go to the next term. So like that, at each level, you will be assessed for the communication skill at all the levels of your medical education. So this is the basic goal of Kalamazoo concession statement. So this is to delineate a set of essential elements in physician-patient communication in order to identify and articulate ways to facilitate teaching and assessment. So 5 A's behavior will give you how you are supposed to communicate with the patient. Now, during your education, you will be assessed based on this model. So this model will assess you. This is the assessment tool. That is the basic you can say what kind of it can be to create a patient center. This is a model to be implemented in healthcare setup. Now, once you are aware of all these things, whether you are putting it into the practice or not, that will be assessed by this assessment tool. So this is ultimately you will be monitored or you can say graded based on the skills, your communication skills at different levels of the medical education. So communicating with the patient. So what this Kalamazoo consensus statement is. So this group of the 21 physicians, they identify 7 essential sets of communication tasks. So they have given the guidelines also. Build the doctor-patient relation, open the discussion, gather the information, understand the patient's perspective, shares the information, reach the agreement on problems and plans, and provide a closure. And these broadly supported elements provide a useful framework for communication-oriented curricula and standards. So all the medical schools, they are going to be following these 7 essential sets of communication that to improve the patient doctor-patient relationship. So as a medical graduate, this IMG new CBME guidelines, you will be assessed on the basis of communication skills. These are the 7 points on which you will be assessed. And then only you will be declared as a successful Indian medical graduate. So for tomorrow, you should be knowing during your NEET, you can say exit exam, you will be assessed on these points. First is building a doctor-patient relation, opens the discussion, gather the information, understand the patient's perspective, shares the information, reach the agreement on problems and plans, and provides the closure. So this is the points on which you will be assessed. And then your grading will be done on the basis of a Likert scale. So the interpersonal and communication skills, this Kalamazoo essential element communication checklist is given on the basis of that, this checklist, previous one. So these are the points to be checked in a medical graduate, and that will be done by the grading. So grading points will be whether he has done well, he needs improvement, no, he has not done, and this is whether it is applicable to that person or not, depending on the scenario or situation, he or she will be graded. That means you only, tomorrow's physicians or the doctors, you are going to be assessed on the basis of this grading scale called as the Likert scale. So following this, the patient's management is appropriately altered to achieve the ultimate goal of all these things is after the training, after you have been made aware of how you should be communicating with the patient, after that, are you putting it into the practice and achieving this interpersonal and communication skills, you will be graded, and from that, it's going to be decided whether you will be able to be a successful or a good practitioner or not, a good physician, a good doctor or not. And that is the ultimate goal is for the patient's management is appropriately altered to achieve the competent healthcare. So ultimate aim is to give a competent healthcare provider to the society. So a medical education aims to provide a competent healthcare provider to the society, and all these things you have to go through during your different levels of medical education. This is what is to be understood. So these 7 points, what Kalamazoo statement is done, so you will be assessed. On the first point, that is builds a relationship. How they will be assessing you? That is, they will monitor whether you greet and shows interest in the patient as a person or not. So here is your scale. So you can be great whether depending on the situation, you are going to be graded like this here. Next is uses words that show care and concern throughout the interview. Next, uses tone, pace, eye contact, and posture that shows care and concerns to the patient. So these 3 points under the first point, that is builds the relationship. So all these 7 elements of Kalamazoo statement are being subcategorized further. So you will be assessed on each of these points. See, so first you will be assessed under the building of relationship. These are the points here, which you have been already taught. Everything has been taught, and then you are going to be assessed based on these guidelines. Next is opens the discussion. How he or she will be monitored. He will be seen whether he allows the patient to complete opening statement without interruption. Then he asks or gives confidence to get the complete information from the patient. Is there anything else to be told to elicit full set of the concern? So he is ready to get the information from the patient. Then explains or negotiates an agenda for the visit. So he is comfortable or he is ready or willing to get the proper information for the patient's next visit or not. So all these things are going to be graded. Next point, gather information. So begins with the patient story using open-ended question. So once the patient comes, how you greet that patient, how you start with the discussion, how you start collecting the patient's history. So are you making the patient comfortable with you? Whether you really try to get or collect all the information from the patient, that you will be monitored, and whether you are trying to collect all the information about the situation, about the relatives, about the family members, about all the background of the patient, clarifies details as necessary with more specific yes or no question. So whether you are giving time to for the patient to express his or her views, then summarizes and gives patient opportunity to correct or add the information. If additional doubts, if he or she is having, the patient is having, are you allowing them? Then the transition effectively to additional questions. Are you able or are you open to get additional questions from the patient, or you are bombarding whatever you know the way you want to do, you are doing it from your point of view only? That will be monitored under this point. Next is understand the patient's perspective. So asks about life events, circumstances, other people that might affect the health of the patient, elicits patient's beliefs, concerns, and expectation about illness and treatment. Response is explicitly to patient's statements, ideas, feelings, values, etc. So in cases of certain chronic illnesses, are you trying to cope up with the patient's circumstances, people, relatives, family members, or any local concerns, culture, beliefs, expectation, life events of the patient? Are you trying to take into account before you come to the action plan or not? That will be assessed. Next is sharing the information. This assesses patient's understanding of problem and desire for more information. Are you conveying the patient about the situation and treatment plan in a proper way? If the patient is expecting more from you, are you in a position to give the that related information? Explains using words that are easy for the patient to understand. Next, it checks for mutual understanding of diagnostic and treatment plans, asks whether patient has any question. So during this sharing of information, where you are looking into matter whether the patient is really in a position to get what you are telling or not. Next comes the reaches the agreement if new or changed plans. So includes patient in choices, decisions to the extent he or she desires. Asks about patient's ability to follow diagnostic or treatment plans, identifies additional resources as appropriate. So this I have already told. So you will be monitored about whether the patient is in a position to agree with you, the ways, different ways for follow-up, and any changes he or she needs during the course of treatment, that will be done. Next is, after doing all the things, whether you successfully try to end up this communication with the patient, whether the patient is, you can say, agreeing or disagreeing, or any other concerns have been raised. Somehow you try to clarify the patient's doubts, and then you come to the end of your communication between the patient, and the treatment plan is going to be based on the closure. So asks whether the patient has questions, concerns, or any other issue, summarizes the whole situation, clarifies the follow-up or the contact arrangement, acknowledges the patient, and closes the interview. So at the end, he or she, whether the doctor is communicating or taking leave of a patient with a good note, saying all is going to be well, or let us see tomorrow, we will meet again on this date. Like that, whether the closure is properly done or not, and that too after the patient is satisfied with all his questions, concerns, and other issues. So this is going to provide the basis for the gradation of the medical graduate on the basis of these points of communication skills. So based on this, the total summary of this gradation will decide whether you are going to be successful, will be capable graduate or not. And the observer will be having this details. So the date on which it was done, the setting, who was the learner and who was the observer. So this has been taken from the Bayer-Pfizer group of physician-patient communication in medical education, developed in May, published in May 2001 from this academic medicine journal. Essential elements of communication in medical encounters, the Kalamazoo consensus statements. So this will be the assessment of the medical graduate based on these 7 essential setup of communication tasks, and they are built up by the 7 evidence-based essential elements. So this is about the Kalamazoo statement, consensus statement for healthcare. So these, having analyzed the elements of Kalamazoo consensus statement, the healthcare team must collaborate and devise further plan of action with regards to patients' well-being. So ultimate aim is we have to look for the patient well-being. So these are the 2 important. So to conclude my topic today, I can say these 2 well-studied models of communication can facilitate a competent doctor-patient relationship. This is my reference. Therefrom, I have collected information for Kalamazoo, and other thing that I have told you in the beginning, that is the AETCOM manual published recently by Nitin Ashok John from the CBS publisher. So to summarize this, we have to follow all these things. Acknowledge and understand the patient as an individual. This will provide useful information, facilitate shared decision making, ensure patient comfort, consider patient motivation and readiness. So all this is the effective communication. This will provide effective communication between the patient and the doctor. So in this new global scenario, for you as a medical graduate, the success will be decided in the new global and diverse workplace required that is based on you how excellent you are able to in the communication skills. So in the new global and diverse workplace requires excellent communication skill that is going to be the basis for your success. So I hope I have tried to simplify as much as possible the objectives of this foundation of communication. I have tried to convey you what are the aspects of the communication skill, what are the ways by which it should go during the patient-doctor communication, and how it can be assessed for a successful medical graduate. Now this will be dealt in the next class with the small group activity, that is by creating some scenarios between the doctor patient by some role plays, or you will be shown how different situation where the patient and doctor communication is going to be well or not, like that. And on this now you are supposed to write the reflections on what is basis of the doctor patient communication. So I hope all of you will do that. Okay, any doubts, any queries you have? Anything you want to ask, you can feel free to ask. If not, I will close this. Thank you. Bye.
Thank you, ma'am.